So, hey, lovelies, how are we doing today? Trust we are good. So, quick one. I did realize something. I made a post with regards to health checks. Must do health checks for women from the age of 35 and above. And surprisingly, that particular post had a lot of shares. So, it simply means something that women in their 30s are really very interested with regards wellness check. And I think that is very good and very impressive to know. And so I'm going to start the new year talking about these aspects of our wellness check because I realized something. You see, before I even go ahead, I realized that women who come to see me in the clinic, usually doing my day-to-day management of patients, especially, for instance, when I'm trying to book for a procedure like a surgery, when patients are being followed up for a surgery or walks up for a surgery, you just want to check the patient's blood pressure, and you see that patient's blood pressure is so high. I've had a high-profile client. She came for a normal consultation, like just for something else. And I'm like, okay, I just looked at her waist. I said, okay, let me just have a look at your blood pressure. And the blood pressure was like 200 over 120 something, very high to really cause serious complications. And in so many cases, I've told the patients, you see, we need to optimize your blood pressure first before we talk about things like you want to get pregnant and other things like that. And so this happens on and on and on. And really, healthcare is expensive all over the world, including Nigeria, because of obviously a lot of factors. Cost of living, exchange rates, and doctors trying to update their training and international certifications obtained. And of course, for doctors to also meet up with their own lifestyle. And also the disposables, equipment, things that are being used in the hospitals, really expensive. So quality healthcare is even much more expensive. So what can you do? The easiest thing to do is to be on the side of prevention, because prevention has always been better, is cheaper than cure, both for the patients and for the clinician. Because for us, it's easier for us to manage less complicated cases. And so to bring to the fore this discussion, I talked about a lot of things. One is our blood pressure check. That's the one clinical examination I mentioned. And that looks like the easiest, but yet a lot of women do not even do that. So as I'm talking to you, I'm also talking to myself. So this is my, I have a BP apparatus here. I've had it for years. You can get anyone you want. I'm not influencing anything. I'm just telling you that I have a BP apparatus. It's, I use Omron. So if you don't have this, you need to find ways to check if you're in your 30s. And I also know from my experience with patients that most women do not comply to instructions. They do not adhere to instructions except you tell them why they have to do that. For example, okay, after a cesarean section, madam, you need to get this blood thinning medication to help you prevent you from having blood clots. Doctor, no, it's expensive. By the time you educate the woman about the reason why she should get that, the money will definitely come. I don't know how, but she's going to get that money because you have told her why she needs to do that. So, firstly, before I talk about why you need to check your blood pressure, what is normal, the factors that put you at risk, and why you have to always be on top of that. And I know you may not comply, but I have to tell you why. If I tell you why, you probably will comply. So my next video, I'm going to tell you why you should check your blood pressure, how often you should check that. Yes, it depends on your risk. It depends on what you find. All right. It depends on other associated symptoms and other factors. So for now, Have a lovely day. Please don't forget to like, share, comment. Tell me how you feel about what I just said. And I really want to see your comment sections there. That's what keeps me going with making posts, because it's really not so easy creating this content of a thing, but we are trying. So have a lovely day, ladies. Bye.